Hello, welcome to this video. And this video will be on a very important concept, very important issue. And the topic is CPR, cardiopulmonary resuscitation. So this will be a theoretical aspect of CPR. So in this session, I will focus on giving you the theoretical basis, okay? So we may not be able to do the demonstration. That will be the focus of another video, which will be done after this. So the objective of this particular series, this particular topic is to give you the foundation. So the foundational aspect, the background, so that you'll be able to understand what you are doing if you happen to come across any need for CPR to be performed. Again, CPR, CPR, okay? So C stands for cardio, okay? Cardio, P is pulmonary, and R is resuscitation. So this is actually what the CPR stands for. So cardio is the heart, pulmonary is the lungs, and of course resuscitation means to revive. So the meaning is that the heart and the lungs are not working. They are not fulfilling the basic functions. Of course, you know that the basic function of the heart is to pump blood, okay? Why the basic functions of the lungs is to, to exchange gas. So to bring in oxygen and then of course expel carbon dioxide. Okay, so the heart is a very important organ. The lungs, very important organ. So if those two organs are not working, of course, the life is going to be cut short if nothing is done. If no intervention is done to somebody whose two organs, the heart and the lungs, are not working, of course, you know that that person will die, because nobody can live without those two organs performing optimally. All right, so so this is one of the emergencies that you may come across, and when somebody is in this type of emergency whereby the heart and the lungs are not working, then you need to respond. And the best first aid to provide to such a person is CPR, cardiopulmonary resuscitation. So there are, so for you to consider providing CPR to any person, there are some conditions that that person must be in. So you cannot just jump in and begin to perform CPR on somebody. No, there are some conditions that must be satisfied before you can talk about performing CPR on somebody. So the number one is that that person must be unconscious. So unconsciousness, okay, unconsciousness is one of them. Okay, and then of course the person is not breathing, So lack of breathing, or the person is what you call agonal breathing, okay? Agonal gasps. So this is abnormal kind of breathing. So these are the two conditions. Of course, there is also this other condition of no pulse. Okay, so the person is unconscious, the person is not breathing, or the person is abnormally breathing, and there is no pulse. Okay, so if you see those conditions in anybody, so what that means is that this person qualifies to have CPR performed upon him or upon her. Okay, so please note this down. If somebody is unconscious, but the person is breathing, you should not perform CPR. Okay, or maybe somebody is not breathing, but the person is conscious. Okay, so you are not expected to perform CPR. So for you to perform CPR, you have to have unconsciousness and not breathing, or the person is agonally breathing, and of course no pulse. But honestly speaking, if you see these two conditions in somebody, that person needs CPR. But you can also add this if you are a healthcare provider. Okay, so there are, so what could be the reason why somebody's heart and lungs, what could be the reason for those two organs not performing? One of the main reasons why somebody could be in this condition is cardiac arrest. So cardiac arrest is very rampant, okay? Very, very common. And cardiac arrest simply means that the heart stops performing all of a sudden. There's no warning. So cardiac arrest can happen, without warning, just the heart stops working. And of course, if that happens, the person will go unconscious. And of course, other organs will be affected because if the blood is not pumping, the heart is not pumping, the blood is not being distributed, oxygen is not getting to the brain, oxygen is not getting to the vital organs. Nobody is going to survive under that type of condition. So, so for this person a person in cardiac arrest to have a chance of living, somebody have to perform CPR, okay? So when you do CPR, you're actually doing two things. Normally, unless there is any reason why you should not do the second one, but let me tell you what you do. So you do CPR in cycles of 30. Okay, let me not put this number now. It says chest compressions. So this is one of the things you do, followed by what you call rescue breath. Okay, so this is actually what CPR comprises of: chest compressions and rescue breath. Okay, and so you do CPR in cycles. So you do CPR in cycles. And one cycle of CPR comprises of 30 chest compressions followed by 2 breaths. Okay, so 30 chest compressions followed by 2 breaths. Okay, and you keep on, you repeat. All right, but before you start performing CPR on somebody, okay, after you have done the assessment, you discover that somebody is unconscious, somebody is not breathing. Okay, so, and then you now decide to perform CPR on somebody. There is something you must do. So you have to make sure you call the emergency number, okay? EMS, Emergency Medical Services. So 911 in our location, we call 911. But in other locations, they may have their own number. So you should be familiar with the number. But over here, we call 911. So you have to call 911 to report the case and also to ask them that you need additional help. So when you call 911, you're actually telling them that you need help. Okay, the help you may not be able to provide. So CPR is a basic care, but EMS will come with more advanced help. So when you call them, you tell them what is going on. Okay, tell them you need AED. So AED is a machine. I will do another video on AED, and then so you start CPR. So while you're doing CPR, help is on the way coming. Okay, and then you start your series of 30 chest compression followed by 2 breaths. So I'm going to put it in this form. Okay, so I'm going to put it in this form. So this is a cycle. So you do this cycle n times. So we don't know the number of n. So what that means that when you start CPR, you don't know how many cycles you will do. Okay, so you have to continue doing that. There are 5 events that can stop you. So there are 5 events that can stop you. And until any of those events happen, you are expected to continue doing series or cycles of 30 chest compressions followed by 2 breaths. So those 5 events that can stop you will be safety. So if while you are doing CPR, safety is no longer guaranteed, okay? Nobody expects you to continue doing this when your life is in danger. Another thing that can stop is if EMS, remember you called 911. So when they arrive and take over, of course, you are expected to stop, or you become so exhausted. Okay, you become so exhausted. So let's assume you have been doing this for long. Okay, nobody showed up and now you can't continue. You're so exhausted that you cannot do anymore. All right, so you can stop. Or this person, the person you are performing CPR on, begins to breathe. So begins to breathe on his own. The person begins to breathe on his own. So the person breathes on his own. And another event that can make you stop is if a bystander, okay, if a bystander comes who knows how to do it and then relieves you. Okay, a bystander could be a colleague, it could be anybody. All right, so those are the stuff, 5 events, any of them that can stop you. Otherwise, you have to keep on doing cycles of 30 chest compressions followed by 2 breaths, okay? Now, I want to talk about different age groups, okay? So there are 3 age groups that could be your patient. A patient is the person that you're performing CPR or you can call the person a victim. So a victim could be an infant, okay, an infant, or you call a baby, okay, or a child. Another possibility is an adult. So these are the 3 age groups likely. So at any point in time, the patient could be any of these, okay? An infant is somebody who is under 1 year. A child is somebody who is more than 1 year but has not reached the puberty. So between 1 year and puberty, that is a child, and adult is from puberty up. As soon as somebody starts puberty, or somebody that reached the age of puberty, from there on, that person becomes an adult. So if I'm doing CPR on a baby, I'm going to use 2 fingers, okay? If I'm doing it on a child, I'm going to use 1 hand. Okay, let's assume a child of 1.5 years. So I'm going to use 1 hand. And if I'm doing it on an adult, I'm going to use both hands, okay? During the next video that I'm going to do, which will be practical, which will be a live, I'm going to do the demonstration. You're going to see that, okay? Of course, if you're in doubt, you treat this person as an adult. Okay, so you keep on doing that. And the last thing I want to talk about is quality. So we talk about high quality CPR. So it's not just performing CPR. We emphasize on high quality CPR. High quality CPR. That is actually what is important. Okay, high quality CPR. And there are 4 attributes of high quality CPR. Okay, 4 attributes, okay, of high quality, okay, CPR. So those 4 attributes, so for you to claim that the CPR you are doing is of high quality, there should be 4 attributes. And the most important attribute, so this is the most important thing to remember when you perform CPR on somebody, is to push hard, okay, and fast at the center of the chest. So push hard and fast at the center of the chest. It doesn't matter the age. This is very important, irrespective of age. So this is not dependent on age. What is a baby? You are expected to push hard and fast. Okay, this is where people have problem when they perform CPR on younger patient, younger victim. Okay, they don't push hard and fast because of fear. Okay, so number 2 is rate of compressions. So rate means how many compressions are you expected to put in 1 minute. And the expected rate is between 100 and 120 in 1 minute. So this is the rate. Anything short of that is no longer high quality CPR. Now, number 3 is depth. How deep are you expected to compress? Remember, you're pushing hard. So how deep? So it depends. So I'm going to give you the numbers. So if the person is an infant, okay, if the person is an infant, so the depth will be 4 centimeters or 1.5 inches or 1/3 of the baby's AP. AP means anterior posterior diameter. So if this is a child, then the depth will be 5, okay, 5 centimeters, and which is 2 inches, or 1/3 of the child's AP. Okay, and if this is an adult, okay, adult is 5 centimeters or 2 inches, okay? So that is the depth there. So the 4th attribute is you must allow the chest, okay, to recoil fully. So 100% recoil fully between compressions. Okay, this is what we call diastolic. So, and this is very important because this is the time when the blood flows back to the heart. So if you don't allow if you don't allow the chest to recoil when you compress, and then the heart should come back, okay? And so if you don't do that, you are not helping this person because you are not allowing blood to return to the heart. So most of these things will make sense during the demonstration, okay? So before I conclude, I want to let you know that before you perform CPR, that patient must lie on a hard, firm surface, okay? And and you need to look at the center of the chest where you place, if a baby, you use 2 fingers, if a child, you use 1 hand, if it's an adult, you use 2 hands, okay? So, so this is what I want to share at this time. I'm hoping that you will join in the next video presentation. That will be very important, okay? So please, I'm also gonna ask you to subscribe, okay? Subscribe, because I have a lot of videos to present, a lot of topics to cover. So when you subscribe and I upload a new video, you're going to get notified. And that way you know that new video is there. All right, so thank you. And I'm going to see you in my next video, and that is gonna come.